Hi, this is Jenny Bear of Living Well Dallas, and today I'm here with Dr. Carol Villanueva.
Hello.
And we are going to cover a variety of really fun topics. But we're going to go ahead and start off with, I would like to know a couple things. Please tell our audience at home why you became a doctor, number one. And number two is, what kind of medicine do you practice here at Living Well?
Sure. I became a doctor because when I was 5 years old, I had a dream to fix people's broken hearts, and that's where it all started. So it never really changed. As I got older, I still had an interest in medicine. I loved science classes. The more I learned about medicine, the more I knew I wanted to do it. So it was less of a choice for me and more of a part of who I was, and it was just following my path that was meant to be for me. And now the type of medicine is what's really intriguing and what really probably changed throughout my life. I could not have predicted that this is the type of medicine that I would have been practicing years ago, or certainly when I was a 5-year-old. But this is truly what I believe I was meant to be doing. The type of medicine that we practice here at Living Well is different than most traditional internal medicine doctors. So I'm certified in internal medicine. I'm board certified in internal medicine, and that's what my traditional training has been in. Shortly after I opened up an outpatient practice, I realized our sick healthcare system was not the way to keep people healthy people, to keep them in their optimal health and truly prevent disease, and it really wasn't working to cure or truly treat chronic disease either. So from that point is when I, through influential people and nutritionists that I met, I got connected with the Institute of Functional Medicine. That's where my postgraduate training came in and taught me about lifestyle medicine and something called functional medicine. That focus is truly on looking at the root cause of disease. So when you look at a symptom, you're not just treating the symptom to cover up what's going on. You're looking at why is that symptom showing up in the first place? What is dysfunctional in the body's system that's causing that symptom to show up? And that's truly the philosophy behind functional medicine. We're looking at what's the root cause of disease, and that's the way that we try to approach things, from a patient perspective here, and from the preventative perspective, we use that same philosophy and sort of just trying to keep the body in its optimal state of health to allow for preventing illness.
Mm-hmm. I love it. And so tell me a little bit about, you also have a sort of a medical partner in crime, Dr. Corey Rice. So tell me a little bit more about how you and Corey started your practice before you came over to Living Well.
Absolutely. So Dr. Rice and I actually met in residency. We did our traditional training in internal medicine together, and we both did our chief resident year together at Methodist Dallas Medical Center. And we really, truly from the beginning shared the same philosophy of medicine, and the way that we believe in treating patients, and the way that we believe in talking to patients at bedside, and those kind of things. So we very much so connected from the start. And then as we went through our postgraduate training, we went through our training at the Institute of Functional Medicine together, and all of our nutrition and lifestyle medicine training we did together. So we both kind of saw the place and how this could help us we opened up our outpatient clinic together straight out of residency, and saw the same pitfalls, learned the same things, realized we were both struggling to see what else we could do for people to make them better. How can we make our practice better? How can we serve our patients better? What can we do for them? So through connecting that way, and through our shared vision and how we hope to deliver medicine, we were able to join forces and hopefully create something big.
And you are. And we will. So stay tuned because we're going to come back at you with another video talking more about functional medicine and also BioT, hormone balancing. So thank you for the segment, Dr. V.
Thank you for having me.
You bet.